This project is about trying to find out if we can identify people who are at high risk of developing pancreatic cancer simply by looking at information that we already have on them through their GPs. So what we've done is taken some GP information for a group of people who we know went on to have pancreatic cancer, and we compared it to information from people we know who didn't. And we've been looking using some new techniques called machine learning or artificial intelligence at those records to see whether there's a pattern that a computer can see that a GP can't. So we've discovered that we do indeed have data that shows that people with pancreatic cancer have different patterns of symptom report in their GP records before they have the disease. But at the moment, we haven't got quite enough information and quite enough people to definitely know whether this could be used. So we're planning another study to examine that in a little bit more detail. So the models that we fitted to our data show that about 40% of the population in our study are at higher risk of developing pancreatic cancer. That's far too high for a screening program, but potentially this sort of technology could be used to identify people who could be screened. At the moment, there isn't a test for pancreatic cancer that could be used for the whole population. It would be far too expensive and far too invasive to test everyone. But if we can use our algorithm to narrow down the people who would benefit from screening, and if there's a little bit more progress in a urine test or a blood test that can show somebody might have pancreatic cancer, matched together, these could lead to a targeted screening situation where people who are at higher risk have a non-invasive test which may show that they have early stage disease. This is really important because pancreatic cancer is a very devastating disease, and people who are diagnosed with it usually rapidly very ill and die very quickly. So if we can make any progress in assessing whether people are likely to have it and diagnosing them early when their tumours can be treated more effectively, that will be a real benefit to the patients.